Hey, this is Dr. Bhalani. We're here doing an L-2 Kyphoplasty on a patient. I want to walk you through some of the steps of it. We've initially numbed the skin, and now we actually have the jam sheeting needle in the patient. We're going through a pedicle at the L2. This patient has had a prior L-1 Kyphoplasty that's present as well. We're here with our USF fellow, Dr. Eduardo Chen, teaching as well, and the patient has been kind enough to let us tape her. As we go through this, we'll give you increments of the procedure as we advance the needle and so forth. Thank you. So we've now advanced the jam sheeting needle all the way to the lateral process. Can I get a lateral, please? Past the lateral portion where we need to be in the vertebral body. You'll see here on the right side of the screen, we've just swapped it over, and the jam sheeting needle is in. Again, her L1 kyphoplasty is right above. Her L1 kyphoplasty and the compression fracture was much worse, which I performed a kyphoplasty on in 2015. And we're now going to take a new lateral of this patient. And we've just started to enter into the vertebral body portion on that left side. So we're going to advance it a little more than the way it currently is. Do me a favor, Dr. Chen, can I get a couple more taps here, please?
Absolutely.
Ma'am, are you doing okay? Yeah. Okay, great. And the patient is doing great. She's been numbed up with plenty of local anesthetic. We're going to the right spot. At this point, we're going to advance it a little more. Go ahead, Dr. Chen. Perfect. Let's give it a couple more gentle taps, and we'll go ahead and go with the drill. Good. Perfect. That looks fantastic. Okay, we're going to go ahead and go to the drilling portion now, which will be the next portion we let you do. Okay, so at this point, we've gotten the jam sheeting needle in to where we want it on the AP view and lateral view. We're going to go ahead and try to cross that midline border with a unipedicular approach. So I'm going to have Dr. Chen here with me. We're going to go ahead and put in the drill and try to get across the midline. So go ahead and give me a lateral, please. Dr. Chen, go ahead and take that tip out, and we're going to go ahead and drill. Sorry, honey, okay? This is the part that's a little uncomfortable when the stylet comes out here, okay? Very good. You're doing fantastic. So you can see there now it's hollow, okay? And we're going to go ahead and insert the drill. As the drill is being inserted here, go ahead and show them that tip of that drill, Dr. Chen. Go ahead and take it out and just show them the tip of the drill, please. So you can see there's a drill there. That drill will allow us to cross across that vertebral body and drill out a little bit of tissue. So now he's inserting that drill down. You'll see on the picture that the drill is now... No, not you, honey. You're doing great. You can see the drill that's there. So Dr. Chen, you're going to torque it that way a little bit and twist in one direction clockwise, okay? Go ahead, give it a good twist. Very good, let's take a picture. Good, go ahead, keep torquing it towards Brian and advance it. Drill, good. That's advancing nice and smoothly, correct? You want it to go a little inferior, so torque it that way. Good, and let's go ahead and advance a little bit more.
Feeling pressure,
feel
Jackie?
Yeah.
Okay, if it's too much, you tell me, sweetie. Is it too much?
No, I'm okay.
Okay, you're doing wonderful, okay?
Okay.
All right, go ahead, Dr. Chen, give it another half a twist of a drill. Good job. Okay, you're doing excellent. Let's come back around and let's see if we're crossing the midline on the AP.
You want me to say that?
Yes, I do. So she is rotated a little bit, but you can see on that image now we're getting a beautiful picture, and it's already starting to cross the midline as it is. Go ahead and zoom in on that, Lee, a little bit. You can see that it's already starting to cross the midline as it is on that vertebral body. And we still have about another 1/3 that we can cross on that space. So thank you very much. So now we're at the part, basically, where we're going to go ahead and insert the balloon in for the kyphoplasty. So go ahead, Dr. Chen, let's go ahead and walk that balloon down. So the balloon has been primed with contrast. Contrast is basically what allows you to see where you're going. You're going to see him as he advances that balloon down. Keep going. You got to get that other white line in. Okay, so you can hold it from the bottom and get there. And you'll see it. You see how the balloon is nicely in the center of the vertebral body. Why don't you go behind me, Lee? You're going to see that the that the balloon is nicely in the middle of that vertebral body. So go ahead and take a mark of where are we, Dr. Chen, for the total contrast?
6.
6. Okay, so you're going to go ahead and take that pressure and make sure we never go into the red zone, okay? And you're going to go ahead and start twisting it, okay? And you will start seeing the balloon starting to inflate slowly. So go ahead, Dr. Chen. Okay, you're going to get a little pressure here. If it's too much pressure, you tell me, honey, okay?
Okay.
All right, you're doing fantastic, by the way.
So I just need.
You can just starting to see the balloon, okay? And the balloon is just starting to creep up and inflate a little bit. Lee, if you don't mind zooming it on that, that would be fantastic. Again, you note the L-2 Kyphoplasty, which was significantly more of a compression fracture above. This has got much more of end plate fractures where she had significant edema. Keep going. You may not see that balloon actually. What's that?
I was just telling him you can twist it a good amount to get it going. Yep, you got it.
Keep going. Now your pressure is going up. Once you see that pressure going up, you're going to start seeing that balloon starting to inflate. Okay? You see that balloon starting to inflate slowly and surely now?
Yep.
Okay? Go ahead and save that picture, please. There you go. That balloon is inflating. Now, that balloon doesn't always uniformly inflate. Okay? You want to slow down and make sure that you get some good spread. That balloon is pretty much inflating superiorly as it is, and that's okay because we just want to create a cavity. That's the most important part of that balloon. Well, how much is the pressure?
8.
8. Okay, let's go ahead and get a little more. We want to try for that balloon not to pop. That's the goal. And sometimes it does naturally because the bone is hard and can poke the balloon. But overall, you see a beautiful inflation of the balloon as we're seeing in this patient currently, okay? Okay, so we're going to go ahead and start injecting some cement. Go ahead. And we'll go live to make sure we're not getting any anterior spread. Move the machine down, please. Stop. Let's go ahead and pull this back a little bit more here. Okay, can I get the bed up a little?
Ready?
Yep. Stop. Okay, much better. Go ahead, and you can start with the. Go ahead, Lee. I'm sorry, Dr. Chen. You can go ahead and start to see the cement is starting to come out already beautifully into that space at the central part of the vertebral body. You feel that?
Yeah, I feel something.
Okay, and that's not a bad thing, okay?
Okay.
How much have you gotten in there so far?
I think we're down to 4.
Okay, so we've gotten about 1 in there so far. Go ahead and inject a little more. Good. Let's stop and hold off there. I'm going to go ahead and move that back because I want to just make sure that we're not going to cross that anterior plate here. Okay. All right, let's go ahead and inject a little more right. Go ahead, another half. Good. Can we get an AP actually, if you don't mind? Let's keep it up. Can I stop that way? Stop the TV. Ready? As you can see, we've actually gotten very nice spread on both sides of the borders on this vertebral body. Go ahead and give me a little more cephalad tilt, please. Thank you. Go ahead and give me the caudate tilt. Keep going, keep going, keep going, keep going. Stop. Thank you. Okay. That's an excellent spread. Now we're going to take another lateral and see if we can inject a little more cement in here and see how much spread we get. You okay?
Yeah.
Okay, you're doing great. Okay, we're almost done. Okay, let's go ahead and see if you can inject any more. Go ahead and get another couple half a twists and let's see how the cement's going. We're always also monitoring to make sure we don't get any posterior spread of that border. We're starting to really rub on that anterior surface, so I'm going to go ahead and pull that back a little more here and go ahead and inject here. Let's go ahead and inject there and let's see how the cement looks as we spread that. Stop. Okay. All right, that looks pretty good, okay? Are you feeling all right?
Yeah.
A little what, sweetie?
Just a little discomfort there for a second, too. Okay.
I think we're
Right.
done, man. So it looks pretty good. You see, you're getting spread both ways, correct? You cross the entirety of the body, essentially, okay? And do me a favor, go ahead and let's get a quick AP. Let's make sure that picture looks good again on an AP. And then I'm going to go ahead and hold this. We're going to go ahead and take this out. We're going to re-style it. Okay, let's get a quick AP first. So the procedure for the L-2 Kyphoplasty is now complete. Thanks to help Dr. Chen, who is our USF fellow that's with us. If you look at the picture here, go ahead and come around with me. You can see her initial kyphoplasty again at 1 and the kyphoplasty at L2. She's got excellent spread of the cement all the way through. There is no breakage of the anterior end plate or the posterior end plate of the wall. And let's go ahead and get a quick AP as well, if you don't mind, Brian, to show the spread. That was when we had the needle in still. And now you're going to see a picture of it with a good midline view. Give me a little more oblique, Brian, please. Thank you. That's perfect. Okay, go ahead and zoom in on that, Lee. So if you could tell, the old L1 kyphoplasty, yeah, let's go ahead and take that out. The old L1 kyphoplasty actually showed that it was more left-sided, but this L2 looks great. It's dead center of the vertebral body. It's getting spread on both sides of the vertebral body, and the patient should feel significant relief within 48 hours, if not within 72 hours. How are you doing, honey?
I'm fine.
Okay, good. So she tolerated the procedure very well. As you can see, go ahead and go up with the arm, please. Go ahead and bring it over here. You can see the patient has no bleeding and a very, very, very little small incision. So we're going to go ahead and dress this incision today, and she will basically be limited to sponge bathing for a week. Okay, sweetie? And we'll come back in and we'll remove this dressing, and hopefully she'll feel a lot better from her back pain. So thank you again, and I want to thank Dr. Chen, who was being of assistance to us for our kyphoplasty. Glad you could learn about the kyphoplasty. Have a great day.